The imaging of sacroiliac joint is preferably done in a PA view because of the angulation of the X-ray images. The images, as it diverges, it will go along the sacroiliac joint. So we prefer the PA view over the AP view. And the PA view is done in which the patient is lying down in prone position, and a cassette is kept, or the detector is kept below the patient, and then the X-ray is centered at a midpoint between the posterior superior iliac spine, and it is usually angulated 5 to 15 degree caudally, depending on the angulation of pelvis. In females, the angulation of pelvis is more, so we give more caudal angulation, and that's how we do the angulation of the image. Now if you go to the image, as I told, the X-rays will be divergent and it will go along the direction of the sacroiliac joint in a PA view. That's why we prefer the PA view over the AP view, and this is how we get a sacroiliac joint imaging. We can see the nice sacroiliac joints with the iliac end and the sacral end of the articular surface. In some patients, when they cannot do prone position, we do sacroiliac joint imaging in AP position. The hip is kept slightly in flex position, and we do the centering at the midpoint between the anterior superior iliac spine, and the X-ray is 5 to 15 degree angulation towards the cranial end, and the X-ray film or the detector is kept behind the patient, and the imaging is done. This is not usually preferred, as we prefer the PA view in the sacroiliac joint. This is how we see that there is an angulation that we get, that 5 to 15 degree angulation towards the cranial end, and this is how we get the image. If you see, the image clarity is not that good as that we saw in a PA view. Oblique sacroiliac joint view, AP oblique sacroiliac joint view, we do when we want to see one side of the joint clearly, and we can do on the other side later to compare the both sides. And this we do by asking the patient in supine position and rotate the hip in the pelvis in the from the non-examining side, so that the examining side is elevated from the table, and we do the centering 2.5 centimeter medial and 5 centimeter inferior to the anterior superior iliac spine. And again, angulation we do the same way as that we do in the regular AP view, that is, we do 5 to 15 degree of angulation towards the caudal end, and this is how we do AP oblique view, and again we can see the sacroiliac joint.